This is a clinical case that I would like to share with you. 72-year-old man, Caucasian ethnicity. He was troubled by effort-induced angina pectoris. He had daily episodes of chest pain on walking upslope, uphill, or even on the flat on cold days. This chest pain was relieved by the administration of sublingual GTN, but these agents cause headache and hypotension. So the patient tried to avoid using these medications as much as he could. He also had frequent palpitations, mainly were isolated palpitations, but occasionally he noticed some sustained arrhythmias. His type 2 diabetes was diagnosed 8 years ago. His HbA1c was not ideally controlled in the region of 8%, 9%. His BMI was raised despite his attempts with the diet. He had a mild reduction in EGFR. Liver function was normal. C-reactive protein was slightly raised, suggesting some inflammatory component at some level in the system. He had a history of COPD, being an ex-smoker of many years. He suffered a silent inferior acute MI, which was non-STEMI, 8 years ago, when he was also found to be dyslipidemic. His blood pressure more recently was on the lower side of the spectrum, 112 over 65 millimeters of mercury in one of the latest consultations. And he had also postural hypotension, and his baseline heart rate was 50 beats per minute. So I would like you to think about the diagnostic tests that you would carry out on this patient.